Nearly 7 years after the Camp Fire damaged and closed the Feather River Hospital, the Paradise Town Council will be considering a plan to address healthcare access on the ridge tonight.
And Action News Now reporter Bella Barbosa joins us live from the Paradise Town Hall, where that town council meeting will be taking place tonight. And Bella, this new plan could mean progress for healthcare access on the ridge.
Yes, Alan, the Paradise Town Council will be considering a draft of the Strategic Healthcare Recovery Plan at tonight's council meeting. This comes after Abaris, a consulting firm hired by the town, completed a year-long study looking at healthcare data and gaps in coverage. The healthcare plan breaks down the recommendations by year and also by population size, projected population size. It looks at between the next 5 and 15 years, a projected population of between 15 and 25,000 people. The plan covers recommendations on hospital and emergency care to long-term care and a lot in between. The plan itself is nearly 100 pages long. Some of the recommendations for the next 5 years include the town considering incentives for healthcare organizations who are considering expanding services, working with Adventist Health Clinic to expand their hours, and changing Adventist Health's clinic license with the state to become an urgent care. I spoke with Colette Curtis, the Recovery and Economic Development Director with the Town of Paradise, about what this means for the future of healthcare on the ridge. She says this plan is a step in the right direction.
It was very important to us that this provide the data that we need, because that has always been the question that we get lots of questions from the public, from healthcare providers, from hospital providers saying, well, how many people are utilizing this type of service, or how many people are going down to Enloe, for example. And that's just not information that we had. And so we wanted an objective look at what the situation is so we can provide that information to potential hospitals or other providers who may want to come in and fill some of those gaps.
A yes vote by the council means they will accept the plan, though it does not implement each recommendation immediately. The town council must choose to look further into the recommendation and take action on it. For example, the plan recommends the council consider zoning, planning, and town infrastructure improvements to pave the way for a potential future hospital. Specifically, the plan recommends continuing conversations with Adventist Health to understand any potential infrastructure and local regulatory barriers they may face in building a hospital here. If accepted, the town would still have to take action on finding the barriers and then proposing or approving these infrastructure improvements. And Curtis says while this plan won't open a hospital in the town right now, it will help to have the data that shows the need for more services in the town, something Curtis hopes will convince a provider to open more services in Paradise. Reporting live in Paradise, Bella Barbosa, Action News Now.
Thank you, Bella. The prepared plan being considered tonight was funded with $75,000 from the Town of Paradise General Fund and another $75,000 from the Adventist Health Feather River Foundation, a charitable organization separate from Adventist Health.